Hello, everyone. Welcome back to another fun episode of Thrive Live. Today, we have guest speaker, Dr. Meg Holpuch, who is our virtual naturopathic pediatric doctor for the Naturopathic Wellness Center clinic. And she also has her in-person clinic in Steamboat Springs, Colorado. So welcome, Dr. Meg. We are so excited to have you back on, especially because we get to talk about a subject that is apparently more common than I even thought, and that is really likely going undiagnosed: PANS and PANDAS.
Absolutely. Thank you, Dr. Jenny. I'm excited to be here on Thrive Live again. So I do practice primarily pediatrics and family medicine in my practice, and as well as with NA Wellness Global. And so I wanted to talk about this topic because it is becoming more and more prevalent. Right now, talking about the diagnosis in children, I think diagnosis-wise, we're seeing one in about 20,000 kids is getting diagnosed with PANS or PANDAS, but in reality, upon research and investigation, about 1 in 600 kiddos at some point in their life experience something similar to this. So the reason I bring this up is because with our current level of health and a lot of different triggers in our environment, including COVID, we are seeing cases of PANS come up. So let's go ahead and let me define it really quick. So PANS, I know it's like PANS and PANDAS. What does that mean, Dr. Meg?
Yeah, what is it? Do you mean do you get a panda bear when you go to the doctor? Or like,
right, you get a panda bear with a little bow tie around his neck now.
Yeah.
So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. So it's a type of autoimmune encephalopathy. So that's like inflammation in the brain. Autoimmunity occurs through a process known as molecular mimicry. We talk about this in other aspects of autoimmunity and testing and things like that. So it's basically where the immune system mistakenly attacks healthy tissues because of the similarities between the particular molecules of the infectious agent, whatever that might be: bacteria, virus, parasite, fungi, mold, Lyme, and the molecules in our own body tissues. And then, so PANDAS is a little bit more specific. So PANS is out here. PANDAS is a subset. And PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder associated with streptococcal infection. So these are the kiddos who get strep throat. And then all of a sudden we have a very large upset in their mental health. And I'm going to actually kind of start off with a case regarding this. Jenny, do you think there's anything else I need to address with PANS or PANDAS before I get into this case?
I mean, I think basically big picture is PANDAS is just PANS post-strep infection.
Yes, exactly. It's just more specific to that because we find that streptococcal bacteria is a huge trigger for this particular post-bacterial syndrome. So this case is a patient of mine that I had about 2 years ago. Zoe, 6-year-old female. So she was a very, very bright child, interacted well with her peers. She grew and developed normal since birth. Mom reports that pregnancy and birth went really well. She was born vaginally, no complications, didn't have to stay in the hospital. She had over, her infancy and toddlerhood, she didn't have any major illnesses that caused any ER visits or, major workup or anything, just normal daycare and preschool illnesses like RSV and hand, foot, mouth, things like that. And then your upper respiratory stuff. So a lot of it was handled at home. Zoe's parents reported that before her infection, she did quote unquote normal kid things. She was loving and affectionate. I mean, she had her moments of struggles. Who doesn't, even as adults? Parents stated that they had their struggles, but nothing like what she experienced after Zoe got strep throat. So Zoe was in first grade at the time, and strep throat was going around at her school. She got it. They, really, really bad sore throat. She just had a hard time. It was a lot of pain. So they went in. They went into the doctor, they did a rapid strep, it was positive, they treated with antibiotics, which is the routine thing to do. Suddenly, it was about 2 weeks after this, things went downhill like overnight. She started with experiencing some OCD symptoms, some obsessive compulsive symptoms. She would only eat off of a certain colored plate. Her food could no longer touch. It had to be a very specific temperature. On top of that, she'd sit there and she'd pick at it and pick at it and pick at it. And then half the time she wouldn't actually eat most of her food. And if she did eat, it was usually only crackers or something like that, that had a crunch to it. Her backpack had to have all the zippers on the left side. Her socks could not go higher than her shoes. So I'm just kind of exemplifying a few of what some very, very particular OCD behaviors were for this young child. Any changes in her routine or schedule resulted in extreme meltdowns that they were so intense that they would often end up going to school 30 minutes to an hour late, because they couldn't get her out the door because of her clothing, her backpack. And then also she couldn't regulate her mood in order to feel safe enough to leave the house. And it got to the point where she even missed school days about once a week. And so then she was falling behind at school. Another big thing was she started to hit her younger brother, who anytime the younger brother was kind of toddling around, anytime he would babble at her or yell, she would come over and wallop him. And the parents were like, this is so weird. She's loved him since the day he was born. They always had a good relationship up until this point. The other thing is she had really bad sleep patterns. Her sleep pattern was off. She would go to bed. She was actually able to fall asleep, which is kind of not always the common case in a Pandas case. But she was able to fall asleep, but she'd only sleep for like 2 hours, and then she'd be up, buzzing around her room, flipping her lights on and off, rearranging her bed, her stuffies, and everything was, and tags were bothersome for her on her stuffies. Sometimes tabs on, or tags on clothing is bothersome for kiddos with sensory disorders. That wasn't the case for her, but anyway, it resulted in a lot of lack of sleep. So it just kind of kept escalating. There was a lot of yelling and screaming, and then the hitting of her younger brother. It got to the point where they didn't leave home often because it was so unbearable for her to leave, and then it was so stressful for the parents. School, when she did make it, was a difficult, no focus. That teacher's statement was, it was like someone switched on the switch of hyperactivity for her. So that was a big red flag as well. So Zoe's parents brought her back into their pediatrician, who ultimately kind of just dismissed their concerns, stating it was normal sexual behavior. And so the parents left going, wow, okay, I guess it is normal. I guess more maybe on the extreme normal. And they kind of tried to rationalize it as a normal behavior. And so anyways, kind of made him feel bad. So things kind of got a little bit better for a little bit, and then they got worse again. After she went through another viral illness. It wasn't technically strep infection, but she did have another infection, and it was just like a big slap in the face for her emotionally, behaviorally. And that was when the parents kind of took things upon themselves and did some online research. And I will tell you, largely, that's where a lot of parents find this information about PANS and Pandas, because there's not a lot of pediatric providers who investigate into it, because it's really a more evolving and more well-researched condition. I would say about 5 years ago, most pediatricians didn't know what it was. Nowadays, PANS and Pandas is being presented at a lot of pediatric conferences. So it's great that we're building more awareness of it with pediatricians. This pediatrician that they went to was like, oh yeah, I've heard of that. I don't think it's that. But they did say, oh, maybe she has autism, maybe she has ODD. ODD is oppositional defiance disorder. So she was referred to a psychologist and to a therapist. And while the parents were like, yeah, that's great, they were like, can you test for Pandas? And the provider was like, not really. I don't think that this is the route you need to go. I think you need to be a psychologist. So anyways, parents kept digging, they kept researching, and they essentially found me. And they were like, you said you know how to work on pandas and pans and diagnose and treat it. I said, I do. And so anyway, they came in, I listened to their story, and I said, absolutely, let's test for it and see what we have going on. And sure enough, I ran a very specific auto antibody test that looks at the auto antibodies towards the brain in the basal ganglia. And she had 2 of the markers sky high, and we just knew that she had neurological inflammation going on. And so we treated the neurological inflammation and supported her body's bacterial balance. And luckily, we pretty much got Zoe back to where she was before the infection, which was fantastic. She does have, some of these kiddos do have a propensity to have a setback again if they are exposed to strep or other infections. But as long as we have on board and we've supported as much as we can that neurological inflammation, a lot of times it's not near as severe as it was before. And then we also have that toolkit just on board ready to give her to prevent the severity like it had the first go around and the second time that she had an infection. So that's Zoe. And, it's a pretty classic case. There's a couple of things that are different for her case. That's not technically specific for pandas, but nonetheless, every case is a little different. So I think it's important to make sure to note everything in a case. And while it may not have been all the classic symptoms, she did have quite a few for pandas. So it's the streptococcal infection causing the neurological inflammation.
Yeah. Yeah. And hopefully, like you were saying, it just becomes more well known so that we can be making these diagnoses as opposed to having the parents having to do like the grassroots effort of searching for answers.
Exactly. And I think that's the big thing. And I think why this is a great conversation to have is to get more information and knowledge out there about PANS and about pandas, because, especially after the pandemic, I mean, mental health is huge. It's huge. And we're seeing all of these new bugs, especially this year. Man, I know Dr. Jenny and I both have kiddos, and this past winter, 2022-23 was a doozy for a lot of families. It was like, all right, we're sick for 2 weeks, we're better for a week, we're sick for another week. Oh, we got it. And it was just this ongoing situation. And I will say there has been an uptick of PANS and panda cases. So we're seeing immune system dysregulation, which offsets that. And then we're just weak from, all sorts of things that we expose ourselves to. I mean, it's tough being a parent right now.
It is. I mean, that's one of my big questions is in the pediatric community, are they seeing more PANS post-COVID?
They are, absolutely. And I would say, while some of the bigger websites have not yet added COVID as a predisposition or predisposing factor as a trigger for PANS, it's been talked about in that community, and we are seeing it as a trigger for PANS. Absolutely. And it could be also a precipitous or like, a compounding factor, right? If say for instance, a family lives in a moldy environment, child's immune system is already probably a little bit taxed from that mold exposure, then they get COVID. And then that's what tips, it's the tip of the iceberg, and it causes, sudden onset of PANS.
Yeah.
Mm-hmm. Yeah. But so, ultimately, while Zoe's case, she covers a lot of things, the other aspects of that we look at for investigating to see if we need to further go down the route of diagnosing PANS or pandas. So we talked about the obsessive compulsive behaviors, motor and vocal tics. Some kiddos have like the blinking tics, or they'll have a tic with their hands, or they'll shake their hands. This is a common one too, and vocal ones, so they'll be repetitive sometimes. Restrictive eating is another really big key indicator for PANS or pandas. Emotional lability. So that would be, the huge, huge meltdowns, the huge dysregulation. We see ADHD like behaviors, so really hard time controlling our behavior at school, sitting still, impulsivity, aggressiveness, bursts of rage or anxiety. There's also depression, oppositional behaviors. We talked about that one, behavioral regression. So sometimes kids, so I did have another case. This was an 8-year-old, and they ended up being diagnosed with PANS, but one of the biggest key factor for this one was the child started having urinary accidents at school, at home, during the night. So they were having enuresis and nocturia. So they almost had to put their 8-year-old in pull-ups during the day and at night. Like, that's a huge regression. Motor and sensory abnormalities. So there again, kiddos start to be sensitive to the texture of their clothing, tags, the tightness of them. Sleep disturbances, we kind of talked about, that can look very different for all different kiddos. A lot of times it is lack of sleep, and their brains have a hard time shutting down. So decline in school performance. And then I talked about the urinary aspect too. So those are kind of the big key factors. And a child doesn't have to have all of these to be diagnosed with PANS or Pandas. It's really about investigative research and looking at the history and the onset of it. There's definitely usually a suddenality with these symptoms too.
Yeah. So now that we know what to look for, what is out there to treat it?
Yes, good question. So conventionally, antibiotics are the treatment of choice for Pandas and for any bacterial caused PANS cases. So like I said, PANS is your bigger umbrella. Pandas is more specific, streptococcal. So streptococcal bacteria, so antibiotics do target it. PANS, if it is another bacteria that causes the PANS symptoms, then antibiotics will be used. And then, I think what's important about that is, yes, it kills the bacteria, but it's not curative, it's not treating neurological inflammation. I think it's good that we absolutely need to get the bacteria out, but we need to support in a lot of other ways. Some children do go on long-term antibiotics, and I think that's where a lot of the research is going right now. For better or worse, I like that they're doing long-term research, but antibiotics are not my go-to be honest. They have a time and a place, and in some cases I do recommend the antibiotic. In some cases we're able to do it without, but the long-term antibiotics are an option especially for also kiddos that have the Pandas that live with a strep carrier. So that's a whole nother thing that we could talk about another time. But a strep carrier, essentially, you can be a carrier of a lot of different things. So that essentially means that you have it in your body, but it's not giving you any symptoms, right? So a parent, even an animal, a dog, can be a strep carrier. So basically, streptococcal bacteria is in their oral flora or their back of the throat, but they show no signs of illness. And with living with kiddos or family members that have that, a lot of times we treat the strep carrier as the same time as we treat the child that is experiencing the symptoms. And that usually is very helpful. But we have to be careful with strep carriers, because a lot of times it'll come back and then we don't know it, and then they spread it. And then we have another round of behavior disorders going on. So long-term antibiotics is being explored there. I will say also that SSRIs are being prescribed for the anxiety, just to kind of bring that child's, compulsive, I'm not gonna say this right, compulsive behavior and their anxiety down, so that they're able to function a little bit better until we're able to really reduce that neurological inflammation. That is sometimes used. Zoloft is a common one. Sometimes we use it, sometimes we don't. There are natural approaches that we use for anti-anxiety in kiddos. Sometimes they work great, sometimes they don't. So, it's kind of a up and down.
Yep. Well, and then also with this neuroinflammation, last week on Thrive Live, I did a whole lecture on the gut-brain barrier access. So from your perspective, is from the naturopathic pediatric perspective, how much of the gut inflammation creating the brain inflammation component do you see here too?
Oh, I mean, significantly, absolutely, because it's our gut makes, gosh, what is it, Dr. Jenny? I think it's now like over 93% of our serotonin. And then think of what that serotonin's looping back into our brain and telling it to do, right? So
Yep.
when our nervous system, our gut I mean, we need to have both of those systems in homeostasis in order to find synergy in the brain and for our mental health. So absolutely. So to kind of bring that in, it talks about, we'll talk a little bit about like some of the areas that I explore and test for in kiddos to investigate more, not so much with the pandas. A lot of times that's just a throat swab and we know it's strep, right? Now for PANS, it can be a little bit more time consuming and take a little bit more of a deep dive. So first off, there is one lab that does the autoantibodies to confirm PANS or PANDAS, and it's called Molecular Labs. They have a panel called the Cunningham panel. They have a great website. You'll find a lot of great information on their site. But they have, it's a panel of 5 markers, 4 of which are autoantibodies. And then another one, I think, is for, it has something to do with, comes along with it. It's not coming to me right now. But, that is a great test because it kind of will confirm more the attack on the brain, because what's happening is a leaky blood-brain barrier, which you probably talked about in your lecture last week, but that's what's happening. And that confirms if we have a leaky blood-brain barrier. Now, this doesn't really identify the cause of PANS, and that's where, a lot of naturopathic testing and investigation comes and just shines, right? We look at Lyme. Lyme's a big one with the co-infections such as Borrelia, that is Lyme, Borrelia, but Bartonella, Ehrlichia, Babesia, looking at mold, looking at toxic elements, in our environment, herbicides, pesticides. These can cause PANS symptoms. Epstein-Barr virus, which is a common virus to cause mononucleosis. Mycoplasma pneumoniae is another big one. Heavy metals, and then stool parasites. A lot of times I'm always going, okay, if I suspect it's Lyme, we do a Lyme and a stool test. Or if I'm like, oh, I think it's mold, we'll do a mold and a stool test, because we have a leaky gut, we have inflammation there. A lot of times that can translate to that leaky blood-brain barrier. Not always, but a lot of times it can. So that bacterial balance in the gut is super important to know what's there, what's not there, and what balance we have of those things. And so basically from there, whatever we investigate and find positive, I treat to that. I support the neurological inflammation. So inflammation in the brain and the body, we support the gut, and we kill whatever the silly pathogen is we find. So
Treat the root and control the fire.
Exactly. And of course we work on symptoms too, right? So we're always trying to mitigate those symptoms for them too.
Right.
Yeah.
Balancing treating the symptoms and then going after the root. Yeah.
Absolutely. Yeah. And I think that's what's great about, what we get to do. And I'm so thankful that we get to do it, is really doing that deep dive into that investigation, because if my child was experiencing this, I'd love to know why. It's really getting to help give an answer and go, this is what we're dealing with. Now we know, and we can treat it appropriately, instead of just throwing another antibiotic at it and going, oh, we hope, or throwing an antifungal at it and go, oh, we hope, which antifungals, prescriptive medications are not medications to mess with.
Right.
Especially in kiddos.
Yeah. Especially in kids. Agreed. Awesome. I think you knocked it out of the park. I can't think of any other questions to ask. Juanita, can you think of anything? I mean, I think just the first step, it just makes it so important of knowing what to look for as parents, or even our nieces and nephews or other kiddos in our life, right? Because the doctors might not be making the diagnosis.
Yeah. And, I always tell people this, like, everybody, all providers are trying to do the best that they can, right? Or at least we hope. You're going to have, just like in any field, you're going to have providers that really investigate and listen, and some that don't. If you don't find the answers you're looking for, don't stop there. And I also encourage parents to always advocate for their child and for themselves. Like, if a doctor tells you no, don't let that, and you feel like it's not right, don't let that be your final answer. Don't let that be, don't stop there. If you feel like there's something more going on, because a mom's intuition, a father's intuition, a caregiver's intuition goes much further than what your provider, who's going to sit there for 5 minutes with your child, is going to say to you. So
Yeah,
absolutely.
definitely. Keep asking the questions.
Keep asking the questions.
We have one question that came in. I'll let you answer, and then I'll give my 2 cents too. But question is, can adults have this?
Oh, absolutely. So it's not considered PANS or Pandas, right? Because that's the pediatric aspect. I think that the diagnosis then goes a little bit deeper with that. And then it gets down to like the diagnosis would be whatever the offending agent is. Yes, an adult absolutely can experience something like this, but in order for it to be PANS or Pandas, I believe it's 12 and under.
Yep. And I think this is also something that, in this category we've been seeing with the post-COVID, right? Kind of bringing it into more current day for the adults is, I think that's a similar, for some patients, it's going to be kind of a similar symptom pathology, that leakiness to the blood-brain barrier. Because just like with the PANS, or the PANS having more of like the Lyme or the COVID or infectious etiology, we can have similar etiology in adults. We just call it something different.
Truly, exactly. And I think the big thing that stands out with the kid, the pediatric population is, a lot of them at this age don't know how to verbalize, I'm feeling fatigued or I'm feeling exhausted. I mean, they know how to verbalize, up to a certain age, their pain. But they also are not as, equipped with using the terms of like, I'm feeling overstimulated or I'm feeling overwhelmed, things like that. And these kiddos, obviously a lot of them don't have these terms yet. And so things look so much more abrupt and extreme. So that's how kids are. I mean, they're using the skills that they have in order to express something's not right in their body. And so I think it's great that parents, actually take the time to listen and go, something's not right. There's got to be something more. This isn't normal. Mm-hmm.
Yeah, definitely.
Yeah.
Perfect. Awesome. Well, I think we hit all the questions. Thank you so much for coming on. I really appreciate it. You always provide some amazing value to these talks.
Absolutely. Well, wonderful. I hope you guys have a great rest of your day.
Thank you. You too. And for those listening next week, I'll be talking about ADD and anxiety. So, all right, everyone have a wonderful weekend. See you next week.